Hello, this is Dr. Russell Scher. I'm on the board of the North Carolina Integrative Medical Society, and we are preparing a most exciting and magnificent conference in Asheville on June 21st and 22nd this year. We have lined up the most incredible speakers, some of the giants in functional medicine, to come and speak and provide wisdom. So I'd like to invite you to consider coming. It's going to be a wonderful event. Today, I have invited Dr. David Brady for an interview to discuss what he will be presenting. Dr. Brady is an experienced integrative practitioner for over 28 years, as well as 24 years in health sciences academia. He's a licensed naturopath in Connecticut and Vermont, and is board certified in functional medicine and clinical nutrition. He is also Chief Medical Officer of Designs for Health, as well as Diagnostic Solutions Lab, and he is the director of the Nutrition Institute. He is also Associate Professor of Clinical Sciences at the University of Bridgeport in Connecticut. So, Dr. David, welcome.
Hey, thanks, Russell. It's great to be with you. We've been friends for a very long time, and it's great to reconnect.
Yeah, it's wonderful to be with you. So I've noticed over the years that you've developed some expertise in autoimmunity, and you've written several papers. I wonder if you can elaborate on this.
Yeah, I became, I guess, somewhat of an expert on autoimmunity just out of sheer desperation, right? It just keeps coming in our office day in and day out. It seems like more and more, and the epidemiological data certainly bears that out. We do have an epidemic in the Western industrialized world of autoimmunity, and it goes right down to our pediatric populations. And if you're going to be in integrative functional medicine, you have a lot of people kind of turning to you for deeper answers than just using immune suppressive types of therapeutics with them, and trying to ask the deep questions, why do I have an autoimmune disease? What's going on that's making my immune system act aberrantly and attack myself? And coinciding with this phenomena is an amazing amount of literature coming out and emerging that is explaining some of the reasons why it's happening in our populations. And so therefore, I've tried to really surveil that literature and stay on top of it, and write about it, and actually develop diagnostics and even therapeutic intervention strategies to try to help us proactively or in an upstream manner try to deal with some of these autoimmune issues.
So I've noticed in some of your talks you've said that autoimmune disease is becoming a modern epidemic. Can you elaborate on that?
Well, yeah, let me give you an example. I mean, at the turn of the 20th century, something like ulcerative colitis, a very, classical inflammatory bowel disorder, a classic autoimmune disorder, the estimated epidemiological incidence in the United States was about 1 in 10,000. Today it's 1 in 250. And you can look at similar types of epidemiological data across a broad range of autoimmune conditions, almost without exception. And that includes atopic disorders, disorders that had been classically defined as Th1 dominant or Th2 dominant, even though those sort of classifications are melting away a bit. It really doesn't matter what autoimmune disease you look at, the epidemiological curves are pretty much straight up. And it's interesting that when public health people and epidemiologists look at the incidence data on autoimmunity, they become very concerned, because the only thing that really goes up that steeply is infectious disease when there's an infectious outbreak. So one of the things we're going to be looking at in my presentation is the role of pathogens and opportunistic microbes in the genesis of this autoimmune epidemic, and why we may be reacting to those microbes in our environment in different ways than we used to.
I've noticed that in functional medicine, we avoid treating symptoms or reacting to the emergence of symptoms, and rather go a bit deeper into root cause. And you've spoken a lot about an approach of being predictive rather than reactive. What do you mean by this?
Well, we have an incredible opportunity in clinical medicine right now that we're not taking advantage of by and large. And, there's exceptions to that rule, people who are doing this kind of work, but by and large, there are a lot of amazing predictive testing opportunities there for physicians that they're not using. And when you look at a broad range of predictive autoantibodies, for instance, and physicians use these tests a lot, if they do a rheumatoid panel, they do rheumatoid factor, or they do CCP, or, they do in thyroid, they do TPO antibodies, or they do, other autoantibodies associated with very specific autoimmune diseases. They often will order these tests, or certainly rheumatologists do, but they're basically using them as a confirming diagnostic. So once the patient already has those symptoms or those ultimate expressions of an autoimmune disorder that they're clinically diagnosable, and they think they have rheumatoid arthritis, or the clinician thinks they have a thyroid issue, or they think they have lupus, or what have you, then they do these tests to confirm their suspicion. But in reality, when you look under the covers of these predictive autoantibody tests, it's been very well investigated, and actually there's good actuary data on them suggesting that they appear in the serum of these individuals 5, 10, 15, 20 years before they would ever have clinical symptoms that would get them a diagnosis of autoimmune disease X, right? So we have an opportunity, instead of when a patient comes in for their annual physical and doing a blood chem and a lipid panel and whatever, the doctor does, what if they had a family history? If you really spent the time to talk to the patient, right? If you have more than 6 minutes to deal with them and you do a good family history and you find out a lot of people in their genetic line have rheumatoid arthritis, or all the females are on Synthroid, right? Or whatever the condition is. If there's a connection in their family history to certain autoimmune conditions or even autoimmune disease in general, why not do predictive autoantibodies? And you can show the patient, listen, we know with an incredible precision on positive predictive value that within 10 years or within 14 years, or it depends on the marker you do and the disease you're dealing with, you will develop this autoimmune disease unless you change the landscape or you change the environment. Because, these are the days of genes, right? And genetics, and everybody's romanced by SNPs and genes, and everything's genetic. But in reality, this epidemic is not driven by genetics, because genetics don't change that fast, right? Certainly there's a genetic component. We know that certain individuals have a predilection or a higher risk to a certain autoimmune disease based on their HLA patterns or based on other genetic uniquenesses to them, but it doesn't mean that they're absolutely going to get it. But it's how we play the genes, right? It's the expression of the genes, and it's the epigenetics. But if we can do these types of tests and tell people, listen, the data is pretty clear with this type of laboratory finding and these predictive autoantibodies, you're going to go on to get rheumatoid arthritis, or you're going to go on to get Hashimoto's unless you do something to not go down the same path that your older family members have gone down. So this means changing their environment. So we're going to look at what are the drivers that actually manipulate the immune response in these genetically susceptible people. And we're going to look at issues including the microbiota, part of the microbiome, and we're going to particularly look at a lot of these associations that have been made between certain aberrant signatures in the GI microbiota, or the composition of the microbes in the gastrointestinal tract, and the incidence of certain autoimmune disease. And we're going to go beyond association, though, and we're going to look at actual emerging causal data that shows mechanisms of action on how an aberrant signature in the GI microbiota, for instance, can actually cause an autoimmune disease. We'll look at issues of citrullination. We'll look at issues of molecular mimicry. We'll look at issues of microbial modification of host proteins, rendering them immunogenic. Some really interesting stuff in the medical literature out there. But once again, this chiasm between medical literature in Western medical paradigm and the practice of clinical medicine is wide. and there's a big delay. But there's an opportunity for us, particularly integrative functional-minded physicians who really want to look upstream, like you were saying, to try to get in front of a disorder instead of solely reacting to it after it's right in front of your face. We can leverage some of this testing and some of this information gathering to not only do the right thing with patients and know the right thing to do with them, but to motivate them to do it, because we have clear, objective data showing this is what's going to happen to you unless you change things in your diet and in your microbiota and in your lifestyle.
Yeah, this is very exciting because in traditional medicine, the solutions are not always the best options. Many of the medications have significant adverse effects. And when someone's diagnosed with an autoimmune disease, they feel doomed. There's nothing really to do except treat the symptoms. And what we're discovering, and what I hear what you're saying, is that there are tremendous solutions so that the person can get back and live their lives well and fully, and learn how to manage this disease. You know, obviously there's still no cure, but there's certainly ways to manage it, where people can live wonderful lives, mostly symptom-free, through natural means.
Well, not only in the functional medicine paradigm can we help manage those patients already with an autoimmune disorder that already have, specific tissue damage, they may have functionality issues, but the real opportunity to me is to not just talk about preventive medicine, but to actually walk our talk, and that is to target and find these patients who will develop a specific autoimmune disease before they develop it, and change their trajectory so they never develop it. Then we don't have to manage it because it never happens. So that's the real value. That's preventive medicine to me. And we have an opportunity to do that right now with testing of the microbiome and the microbiota, their genomics, and predictive autoantibodies, and then changing their diet, changing their lifestyle, changing the things that are dancing with the genes and the immune system in those susceptible people to actually end up 10 years down the road with an autoimmune disorder. And once they have it, we can help them deal with it as well and manage it, in many cases, very effectively. But like you would expect, it depends how far they are down the pike. I mean, if someone comes to me after years of having rheumatoid arthritis that's not well controlled, and they have significant anatomical damage and functionality issues and so forth, then it's much more limited on what we can do. We're not saying we're going to reverse all of that kind of scenario, but many people who are even at the point of diagnosis clinically, but it's a new diagnosis, they're being presented options like you mentioned, strong immunosuppressants, response modifiers, biologics, and so forth. And those drugs, I'm glad we have them for the people who really are in a fulminant, situation, and you really need to, improve their quality of life. But many of the patients I find that are offered that as the only solution are not at the point where they really need that kind of intervention if they're willing to do the other things that we can offer them. And, these days they get on Dr. Google and they go search what was just recommended to them, and they see what these side effects are. And in some of these agents, they're little inconvenient side effects, like leukemia and lymphoma. They see that and they get a little bit concerned. And that's often what drives them deeper into the dark web, and they find an interview with some guy like me, and they end up in my office, right? So, it's interesting, and I'm not trying to criticize those medications. Once again, I'm glad we have them. They have their place, but they can't be the only thing that we offer to people, particularly early in diagnosis. And while those side effects are not common occurrences on people that are put on these agents, certainly if it's it's 100%, So.
Yeah. Well, this is very exciting, and I'm really looking forward to your lecture. I know that you will have key takeaways, things that people can implement right away in their practices to significantly improve the health of their patients. So we're looking forward to it. The details of the conference are below, and please consider registering. The early bird pricing is going away soon, so please register, and we look forward to seeing you in June.